Revolutionizing concussion detection in kids with music. The MuSICCA tool. Imagine a world where music not only entertains, but also heals. A groundbreaking tool called MuSICCA is doing just that by transforming how healthcare teams assess consciousness in children who have suffered severe brain injuries. Designed specifically for kids aged 2 to 18, MuSICCA harnesses the power of live, personalized music performed by a skilled therapist to evoke and capture responses from young patients. This innovative approach addresses a significant gap in reliable diagnostic methods for assessing awareness in children, making it a game-changer in pediatric care. So how does it work? The therapist selects music tailored to each child, performing it live, and adjusting the elements based on the child's reactions. This dynamic interaction allows the child to express their level of consciousness in a way that traditional methods simply can't. The responses are then measured against a diagnostic scale, providing clearer insights into the child's cognitive state. Early feedback from healthcare professionals and families has been overwhelmingly positive, with many praising its validity and effectiveness in clinical settings. Here are some key highlights about MuSICCA. Asterisk Musical Assessment Tool. This innovative tool uses live, personalized music to assess consciousness in children with brain injuries, offering a unique and engaging way to evaluate their awareness. Asterisk High Approval Rate. An impressive 85% of evaluators strongly agree that MuSICCA is both valid and suitable for use with children, showcasing its potential impact in the field. Asterisk Supports care teams. MuSICCA not only aids therapists in identifying patient awareness, but also facilitates effective communication of findings to families and other clinicians, ensuring everyone is on the same page. The need for such a tool is critical. Children with disorders of consciousness often rely entirely on caregivers for their daily needs, from hydration to hygiene. However, assessing their awareness can be incredibly challenging due to the neurodevelopmental changes that occur as they grow. This is where MuSICCA steps in, providing a reliable method to gauge consciousness levels in these vulnerable young patients. Developed by a collaborative team from Anglia Ruskin University, the Children's Trust, and Temple University, MuSICCA is a beacon of hope. During the research, a diverse group of participants, including music therapists, family members of affected children, and healthcare professionals, evaluated the tool. They participated in discussions after a demonstration and rated their agreement with statements regarding MuSICCA's effectiveness and suitability for children. The results were striking, with unanimous agreement on its potential benefits. Dr. Jonathan Poole, a leading researcher in music therapy, emphasized the importance of this tool. Children with disorders of consciousness are often almost completely dependent on others to meet their needs. Their therapists, nurses, and caregivers must interpret very subtle behaviors to help them understand their needs. MuSICCA allows for a rigorous assessment of the patient's response to various musical stimuli, providing a clearer picture of their level of consciousness. The insights gained from MuSICCA are not only valuable for medical teams, but also empower families, helping them understand how they can support their child's recovery journey. This study strongly suggests that MuSICCA is a comprehensive assessment method, highlighting its strengths in guiding care, involving caregivers, and supporting clinical teams. In conclusion, MuSICCA represents a significant advancement in the assessment of consciousness in children with brain injuries. By integrating music therapy into clinical practice, we are not just improving diagnostic methods, we are also enhancing the quality of care for some of our most vulnerable patients. This innovative approach could very well change the landscape of pediatric healthcare, one note at a time.